now joined again, very happy to be joined again by Senator Bernie Sanders, 2020 Democratic candidate for president, who's got a great new plan on the coronavirus relief package. Senator Sanders, welcome back to the show. How are you?
I am, well, given the circumstances, we're doing well. I hope you are as well, Dean.
We are. What a few months when you think about it. You went from an impeachment trial now to a global pandemic. I mean, who would have ever thought that? Do you miss, before we talk about the serious stuff here, I want to just touch on, do you miss the rallies? I mean, I saw you in New Hampshire the night before the vote, and it was snowing out, it was packed, so much energy. Do you miss them?
Well, obviously I do. I mean, you know, I love rallies, and we have hundreds of thousands of people who have been going door to door and state after state. And that's the kind of grassroots campaign that I love and I think we need to wage. But obviously we can't do it right now. But, you know, to pick up on your first point, Dean, we are living in an unprecedented moment in modern American history and, in fact, in world history. And, you know, as every listener knows, we're dealing with not only a terrible pandemic, but we're dealing with an economic meltdown, which is costing us millions and millions of jobs. And what I am working on right now is, with other senators, a major piece of legislation which, in the midst of this terrible crisis, sustains our economy and protects working people.
And I think this is so fundamentally important to do. And can I just throw out there, if you did toilet paper for all, it would change everything. Because right now, there's such a dearth of it. And that touches on something bigger, Senator. Let me ask you honestly, is what we're seeing, literally no toilet paper, no water in stores, that people can't get masks and ventilators, is this on some level a bigger failure of the American extreme vulture capitalism that runs our system?
It is, Dean. It really is. And I think everybody should take a deep breath and ask themselves, how does it happen that in the wealthiest country in the history of the world, forget toilet paper for a moment, but think about doctors and nurses today in hospitals who are putting their lives on the line, and they don't have the appropriate protective equipment that they need. They don't have the masks, the gloves, the gowns they need. We don't have that. And in the hospitals right now, they are running out of the prescription drugs that they need to treat people with the coronavirus. How does this happen in the wealthiest country on earth when we are spending twice as much per capita on health care as do the people of any other country? So if there's any silver lining in this terrible moment in American history, maybe we may want to rethink our value system and our priorities.
I agree. And going to your proposals, I want to touch on a few. And I love the idea of Medicare now helping people. Millions are losing their jobs. And as you point out, millions are going to lose their employer-provided plan. So what do you want to do to take care of these people during a pandemic who are now uninsured or will be uninsured?
Well, I think the first point to be made here is that what is going on right now with millions of people losing their jobs and losing their health care, it really does bring up the question of whether the current healthcare system, which is employer-based, is the kind of healthcare system that we need. And the answer, of course, it is not. Instead of having our healthcare through private insurance tied to our employer, what we need is a Medicare for all healthcare system, which guarantees healthcare to all people as a right, not based on their employment situation. And I think the American people are seeing that at this moment. But in the midst of this crisis right now, when so many of our people are losing their health insurance, what I want to do, I can't put a Medicare for all system into an emergency economic bill, but what I can do is say that during this crisis, nobody in America should have to pay out-of-pocket health care expense. And that means Medicare should cover during the crisis all of the uninsured, all of the underinsured, and for those people who have private insurance still working, covers your deductibles, covers your co-payments, covers the cost of your prescription drugs and out-of-pocket expenses. That is what we should do.
And what's your reaction to the White House not reopening enrollment for the Affordable Care Act?
It is again, what can you say about Donald Trump in this White House? It is unbelievably cruel and awful. If there was ever a time that people needed access to health insurance, this is that moment. I mean, we have the absurd situation, Dean, that in the last stimulus bill, which I voted for because there was a lot of good things in it for working people, but what it does do is if you need a test, the coronavirus test, it covers you, okay? But if you, God forbid, have the coronavirus and end up in the hospital, it does not cover you. So that is absurd, and you will run up thousands of dollars in health care bills. So we want to make sure that all people during this period, not only for the coronavirus, people are being diagnosed with cancer, children are breaking their legs. I want during this emergency period, all people to be able to have the health care they need without out-of-pocket expense.
And I'm speaking with Senator Bernie Sanders. Senator Sanders, I know Medicare for all right now as a huge government expenditure would be tough to do. But again, when you look at FDR during the Great Depression, that's when some of the big programs did come into play, where Americans were looking for a lifeline and big, bold programs that created jobs and were investing in our nation that we take for granted today, from Social Security, Unemployment Act, Tennessee Valley Authority, and the list goes on. Is this not the time to push for big policy proposals, not just stimulus?
It is. Well, I wouldn't call what we're doing, Dean, a stimulus because, when you have a health care crisis, I don't believe people are going to go out building bridges and roads. The immediate crisis, and we have a provision in there, and this is what I think has to be done, and that is to make sure that every American worker continues to receive his or her paycheck. Now, in this last bill that we passed a week or so ago, what we did is provided almost $30 billion for the airline industry, which has been hard hit, and that money goes directly to payroll for all of their employees. The workers in the airline industry, some 2 million employees, will continue to receive their paycheck. I believe that in the midst of this crisis, that is what we should be doing for every worker in this country. I think that is the easiest way to maintain our economy and make sure that every person in this country continues to have the income they need to take care of their basic needs. But to your question, I think this is a moment when we should be asking ourselves some very, very hard questions about American society. And that is not just our dysfunctional healthcare system. It is how we have a nation in which half of our people are living paycheck to paycheck. That was before the crisis. That number obviously is going up right now. Why do we have 500,000 people sleeping out on the streets or in emergency shelters tonight? Why do we have more people in jail than any other country? Why do we have millions of undocumented people scared to death that they could be deported tomorrow rather than moving forward to comprehensive immigration reform, et cetera, et cetera?
Right.
So, Dean, to answer your question, I think immediately in the next few weeks what we've got to do is protect the tens and tens of millions of people who are scared to death about what's going on economically. We've got to make sure that our doctors and nurses can continue to provide health care to all people who walk into a hospital without endangering their own lives. But your point is right. Now is the moment to think about a very different kind of America, an America whose value system is not based on, hey, maybe you can become a multi-billionaire, and rather a system that says, how do we work together to make sure that all of our people have a decent standard of living?
I agree. And last question, because you touch on this in your proposal, the forceful use of the Defense Production Act. And, Governor Cuomo today, we still don't have the equipment. He's bidding against other states. Our doctors on the front line don't have health care equipment they need. Nurses, we don't have ventilators. In New York here, we have more people dead than 9/11 in New York State. And this man, Donald Trump, refuses to use it. I think if he's not going to use it, he should resign and let someone else use it. But is he not letting us down as a nation by not using this?
Oh, my God, Dean. And here is the irony. The Trump administration has used the Defense Production Act many, many times for specific weapon systems and defense needs. What has got to happen right now, here's the truth. According to the Health and Human Services Department, we need billions, not millions, not thousands, billions of masks for the American people, protective masks for the American people, and for our doctors and nurses. Billions. And what the word has got to go out to is the private sector and say, you will not be producing underwear or T-shirts. That's not exactly what we need right now.
Right.
What we need on that, you're going to be fairly compensated for your work, but you've got to do that. And I'll tell you something else. There are hospitals right now in New York, and I expect elsewhere, that do not have the prescription drugs they need to treat people with the COVID-19 virus. And we have got to make sure that the pharmaceutical industry is 24/7 producing those drugs right now, not just figuring out how they can make higher profits.
I agree, Senator. Just the last thing, and it's sort of an observation, but can you believe this is where we are in 2020 as a nation?
Well, this is here's the point that I want to make, Dean, to everybody. We are living, take a deep breath. I mean, we're living in an unprecedented moment in American history, certainly in the modern history of this country. 100 years ago, this country went through the Spanish flu, which was terrible. In the 1930s, we went through the Great Depression, which was terrible. Now we're dealing with both a pandemic and an economic downturn where job loss right now is probably greater than it was during the Great Depression. You got two of those things, and we can't get going because people can't go to work. So we are looking at an unprecedented moment, and we need an unprecedented response from the Congress, both in terms of protecting the healthcare needs of the American people, combating this virus, and there are ways that we can do that, as well as making sure that every American continues to have the income they need to live with dignity.
I wish you the best with it, especially after Mitch McConnell earlier in the week said to Speaker Pelosi, stand down on your fourth plan, which is ridiculous. Americans are in need. But, Senator, I thank you for your time and your leadership on this. And government is the answer, the safety net for people in need, not the enemy the way the Republicans view it. So thank you.
You're absolutely correct on that. All right, I'll talk to you soon, Dean. Take care.
Take care, Senator.